A day of reckoning for the doctor who diagnosed hundreds of patients with cancer when they did not have it.
Misdiagnosing more than 550 patients.
Very upsetting as an oncology nurse.
13 counts of healthcare fraud, providing patients with unnecessary treatments.
I don't think there's any justice. I lost my sister.
And then fraudulently billing healthcare providers.
Disgusting.
Farid Fata was once known as one of the most respected cancer doctors in Michigan, but he resorted to diagnosing completely healthy people with life-threatening cancers. And for those who actually had cancer, treatment doses and frequencies were pushed far beyond medical standards. When federal investigators finally raided his clinics, they uncovered a massive operation that had generated around $34 million in fraudulent claims. After training at major cancer centers in New York, Farid Fata built a medical background that earned instant trust, but he wanted full control. He left the hospital system and moved to Michigan to open his own private practice, Michigan Hematology Oncology, or MHO. His reputation grew fast, allowing him to expand into multiple locations throughout Detroit, complete with his own labs, pharmacies, and radiation centers. He ran a booming business, started a charity called Swan for Life, and had his wife Samar manage operations as CEO, leaving Farid with total authority over how patients were treated. Farid became known for using aggressive cancer treatments. He often told his patients chemotherapy methods followed European or French approaches, which involved stronger doses and more frequent infusions than many other doctors used. While some patients were surprised by how intense the treatments were, many saw it as a sign that he was confident and willing to fight harder to keep them alive. His practice reportedly handled around 1,700 active patients, and many families trusted him because the clinics appeared successful, respected, and professional. But underneath that reputation, warning signs had already started appearing. Farid's first major lawsuit came from one of his patients, Maggie Dorsey. In 2007, accused him of medical malpractice after an experience that completely destroyed her health and nearly destroyed her life. Farid diagnosed her with multiple myeloma, a type of blood cancer that affects plasma cells inside the bone marrow, and soon placed her on an aggressive chemotherapy treatment plan that lasted around 7 months. As the treatments continued, she began losing control in her hands. Walking became difficult. Simple tasks inside the house became painful struggles. Cooking, cleaning, typing, writing, even brushing her daughter's hair slowly became difficult for her to do. Her body developed tremors and weakness that reportedly continued years later. Before chemotherapy, I was able to cook, clean, function in every capacity. I was able to write, type, comb my hair, as well as my daughter's hair. I stopped being able to comb my daughter's hair when she needed me most. What made it even more heartbreaking was Maggie was raising 9 children. She often remained stuck in bed recovering from treatments she believed were keeping her alive. The chemotherapy eventually became so severe that she had to be hospitalized. Maggie decided to seek other medical opinions, but after speaking with other doctors, Maggie learned something that completely shattered everything she knew about her condition. According to those evaluations, she did not have cancer. In fact, they believed she never had cancer at all. That meant months of chemotherapy, physical suffering, and time taken away from her family had all happened because of a diagnosis that should have never been made. Maggie and her husband later sued Farid for malpractice, accusing him of falsely diagnosing her and putting her through unnecessary chemotherapy treatments. The case was eventually settled outside of court in 2009, and publicly the situation was treated as a medical mistake rather than international fraud. Many people still accepted the explanation that this was simply an unfortunate error, but not everybody believed that. One of the people who immediately sensed something was wrong was an oncology nurse named Angela Swantek. On March 31, 2010, Angela interviewed for a job at MHO. The first interview went well, and she returned the next day to shadow inside the clinic. Before arriving, she had already heard about Farid's reputation and expected to see quality cancer care. Instead, what she observed immediately disturbed her. Angela had years of oncology experience and had worked in respected cancer centers before. During her time shadowing at MHO, she noticed some chemotherapy infusions appeared to be given much longer than normal. She gave one example involving the chemotherapy drug Velcade. She explained that it was supposed to be injected through a syringe over about 30 seconds, but she claimed at Farid's clinic it was instead being given through an IV bag over the course of an hour. To Angela, none of it looked medically appropriate. She described it as a chemo mill. There were often 16 to 17 patients lined up waiting for chemotherapy, and the treatments looked excessive and medically questionable. Angela decided not to take the position at the clinic. After leaving early, she filed a formal complaint with Michigan authorities on April 14, 2010. Warning them about Farid's treatment methods and asking investigators to take a closer look at what was happening inside the clinic. For someone with more than 20 years of nursing experience, reporting to a doctor like that was not a small decision. But despite her complaint, nothing really happened. She received the state's response in April 2011, saying investigators could not find enough evidence of public health violations. So the case was closed. Angela later revealed that the state never even contacted her directly during the investigation. And every day, Angela continued seeing patients walk into those offices believing they were receiving life-saving treatment. Even after reports about Farid's treatment methods started surfacing, he kept expanding and opening more clinics in different areas. Eventually, one of those facilities ended up opening near the hospital where Angela worked. Every day she continued working nearby, she watched patients enter MHO believing they were receiving proper cancer treatment. Some arrived terrified after recent diagnoses. Others walked in carrying the exhausted look of people already deep into chemotherapy. That continued until another patient unknowingly walked into his system.
Something that should go over 15 minutes, he ordered to be done in an hour or two.
In 2013, a 51-year-old woman named Monica Flagg visited her primary care physician for a standard checkup. She was simply going through routine testing, the kind that most people barely think about afterward. Her doctor ordered blood work, reviewed the results later, and noticed abnormalities that needed further evaluation. Concerned, the physician referred Monica to Farid Fata for additional testing and consultation. Monica later arrived at one of his cancer centers expecting answers. Farid quickly informed her she had multiple myeloma. The diagnosis landed hard. Monica suddenly found herself sitting inside a cancer center, hearing that her condition was serious enough to require aggressive chemotherapy and long-term maintenance treatment. Farid told her that although the disease had supposedly been caught early, the situation still required intense intervention. According to him, survival depended on staying on chemotherapy permanently. Everything hit Monica all at once, and it was hard for her to process at first. But because Farid already had a strong reputation as a cancer specialist, she trusted him almost immediately and believed he knew what he was doing. According to her, she was still healthy before going to Farid, but after just one round of chemotherapy, everything started changing. On July 1, 2013, Monica received what became her first and last chemotherapy session. After leaving the clinic that day, Monica returned home planning to recover quietly and manage possible side effects from the infusion. At some point, while unpacking a suitcase upstairs, she suddenly tripped and fell. She said that, "I heard both my bones crack. I knew that my leg had been broken in half. I screamed for help." Her husband Steve rushed her to Crittenton Hospital Medical Center in Rochester Hills, where she expected Farid would likely oversee her care. But on that specific day, Farid was overseas visiting Lebanon, so another physician working under him stepped in temporarily. That doctor was Dr. Soe Maunglay. Dr. Maunglay had been covering Farid's patients while he was away. When Monica arrived, he entered the room and began reviewing her chart. He started asking questions about her symptoms. To Monica, the conversation already felt unusual. As Dr. Maunglay reviewed her records, he appeared concerned and told her that the medical findings in her file did not support the cancer treatment she had been receiving. She spent the night in the hospital feeling uneasy about the entire interaction. 2 days later, on July 3, Dr. Maunglay returned to her room while a friend was visiting. He immediately asked the visitor to step outside. After closing the door, Dr. Maunglay got directly to the point. "You're 51 years old. You're extremely active, you're a professional, you're healthy, and you do not have cancer. I work for Dr. Fata, and you need to never go back to him ever again." For Monica, the first feeling was relief. She learned she did not actually have cancer and would no longer need chemotherapy. But almost immediately, another realization replaced that relief. She had already been pulled into treatment for absolutely no reason. Dr. Maunglay had started investigating her records after reviewing the chart more carefully. Once he examined the actual medical data, he realized there was no evidence supporting a multiple myeloma diagnosis at all. Now he was staring directly at evidence showing a healthy woman had been falsely diagnosed and placed into chemotherapy treatment. He found several cases where patients were being given medications they did not medically need. One treatment that stood out was IVIG therapy, a drug normally used for people with serious immune deficiencies. But according to Dr. Maunglay, many of the patients receiving it had no medical record showing they actually qualified for the treatment. Still, they were receiving it anyway. Dr. Maunglay eventually shared his concerns with one of the nurses at the clinic. After reviewing the situation, they agreed that something about the IVIG treatments did not look right, so they confronted Farid directly. What stood out was how quickly Farid backed off. He immediately agreed to stop using IVIG. That reaction felt suspicious. If the treatments were truly necessary, a doctor would normally try to justify them. Employees at the clinic quietly started leaving. Doctors and staff kept resigning. Though most avoided openly saying why, the sudden departures eventually caught the attention of the office manager, George Karache, who later asked Dr. Maunglay what was really happening inside the clinic. George struggled to believe it because the clinic looked successful and full of medical professionals. It did not seem possible that something this serious could be happening unnoticed. But the more he looked at it, the more he remembered hearing staff repeatedly question Farid's unusually aggressive treatment methods. George decided to investigate the situation himself. He started interviewing employees throughout the clinic and quickly noticed that Farid's consultation to treatment ratio was much higher than the other doctors working at MHO. According to the nurses, the IVIG cases revealed that 30 out of the 40 patients who received the drug in a single week did not medically qualify for it. 95% of those patients never should have received IVIG at all. George Karache went to the FBI and also filed a False Claims Act suit. Federal investigators interviewed him on August 2, 2013. Soon after, federal investigators started questioning employees connected to the clinic. A few days later, on the morning of August 6, 2013, the FBI raided Farid's offices. He was arrested on multiple healthcare fraud charges. Farid was initially held on a bond amount of only $170,000, which immediately raised concerns considering the amount of money connected to the case. Federal prosecutors argued he had millions of dollars and could easily flee the country. The bond was raised to $9 million. He remained in custody while investigators continued building the case against him. As federal investigators reviewed the records from the clinic, authorities eventually identified 553 patients who received medically unnecessary infusions or injections, including chemotherapy and other drugs, while others who did have cancer were still subjected to excessive treatments far beyond what they medically needed. Farid continued defending many of these aggressive protocols, but investigators concluded patients were being exposed to unnecessary drugs simply to generate a profit. Farid billed private insurance companies and Medicare for treatments and procedures connected to those patients. He also owned diagnostic facilities connected to his practice, allowing him to generate even more money through additional testing. According to the investigators, it was a constant cycle where unnecessary diagnoses created unnecessary treatment, which created even more billing opportunities. Authorities estimated the scheme generated around $34 million in fraudulent or medically unnecessary claims. Investigators also discovered Farid received illegal kickbacks from local organizations in exchange for patient referrals. He was prescribing extremely expensive medications, including IVIG, intravenous iron treatments, and growth factor drugs. Some of these medications cost thousands of dollars per dose, which made them highly profitable through insurance billing. Federal prosecutors eventually built a long list of charges against Farid: 13 counts of healthcare fraud, 1 count of conspiracy to pay or receive kickbacks, and 2 counts of money laundering. According to Barbara McQuaid, the case was one of the most serious healthcare fraud investigations her office had ever handled. Federal prosecutors also originally accused him of unlawfully obtaining naturalized citizenship, but his guilty plea covered 13 healthcare fraud counts, 1 kickback conspiracy count, and 2 money laundering counts. With the evidence continuing to pile up, Farid pleaded guilty on September 16, 2014, instead of taking the case to trial. The guilty plea confirmed what many former patients had already feared for years, because this was about people's health. During the sentencing, 22 victims and family members stood before the court to explain how Farid's actions permanently changed their lives. Some patients were falsely diagnosed with cancer and forced through chemotherapy they never needed. Others were aggressively overtreated until their health rapidly declined, while some patients with real cancer were never properly diagnosed at all. Families described loved ones declining or dying after being placed under his care. Several victims were left with long-term physical complications, emotional trauma, and financial hardship. Here's what some of the victims later said. When the day of judgment finally came, he apologized and claimed greed and power had consumed him. He also told the court he prayed daily for forgiveness, but for many victims, the apology meant very little compared to the damage already done. Judge Paul Borman sentenced Farid to 45 years in federal prison and ordered him to surrender millions of dollars connected to the fraudulent treatments. The judge ordered him to forfeit $17.6 million from the scheme. After the sentencing, many victims still struggled to recover. Farid had been ordered to forfeit millions of dollars connected to the fraud, and portions of that money were supposed to go toward restitution for patients and families. But years later, many victims were still dealing with delays, rejected claims, and legal complications while trying to access compensation. More than 700 people reportedly applied for restitution funds, yet many families said the process moved painfully slowly. Part of the confusion involved how the money was divided. Reports showed that about $11.9 million was eventually distributed, with $7.6 million going to insurance companies and government healthcare programs, while around $4.2 million went directly to individual patients and families. Many victims said they were still struggling to rebuild their lives after years of unnecessary treatment and medical trauma. As the investigation continued, more details about Farid's personal finances also came out publicly. The record showed he had become obsessed with wealth and luxury during the years he ran MHO. In one email from 2010, he even talked about plans to buy a $3 million castle in Lebanon and asked financial advisors about accessing additional money from trusts connected to his assets. Years later, when Farid appeared in court again, many observers noticed how physically different he looked. According to the reporters, Farid was thin, bald, and frail, an appearance many people compared to the condition of cancer patients after long chemotherapy treatments. Around the same time, his personal life collapsed. His wife divorced him and returned to Lebanon after the scandal destroyed his reputation and career. Let me know your thoughts on this case in the comments below, and don't forget to subscribe.